And hello to you all around the world. We are getting set for the fourth installment, the fourth live broadcast of the science of sleep apnea, screening and diagnosing sleep apnea and primary care made easier with telemedicine. Alex Pavlenko is leading the charge tonight. He is on our broadcast early, saying hello from Edmonton. Alex, I hear you have two sons who are dentists, one of which is going to be shadowing Dr. Height. So that is lovely that you're signed in early and ready to go. Welcome. And as Alex has done, please go ahead and introduce yourself and where you're joining us from. I want to welcome all of you and see where in the world home is for you or you are joining us from. Hello to Brenda. Brenda joins us every week. She says, hi, everybody. Brenda Jungworth from Edmonton, Alberta. Ria joining us tonight. Continue to go ahead, introduce yourself. Let us know where you're joining us from, because I know so many of you know each other, you work together, and I know our guest tonight, Dr. Sanjeev Jain, was an active participant on many of our broadcasts, and he's our guest tonight, so I always appreciated his feedback. I can see that 10 of you are already with us. So introduce yourselves, and all you have to do is grant StreamYard permission to use your name. Otherwise, you will come up as a Facebook user. But we appreciate seeing where you're from. Linda joining us from Naples. Hello, Linda. Appreciate you being with us tonight. Kristen McDonald joining us from Toronto. Welcome to you, Kristen. I love it when you introduce yourselves. I can see our doctors in our green room, and they are watching as well to see who is joining us, because I'm sure so many of them know you. So please don't be shy. This is an interactive discussion tonight. So Stas Pavlenko, I think I just said, I'm hoping hello to your dad. Did I get that right, Tamari? Give me the thumbs up from the virtual green room. Okay, is Stas the one that's going to be shadowing you? All right, Stas, you're learning from the best. If you get to shadow Dr. Tamari Height, welcome to you. We appreciate you being with us this evening. It's going to be a rich discussion. And I'm just allowing you all who are joining us to say hello, let us know where you are. And sometimes it takes a little bit of time for everybody to log on to the different areas, whether on Facebook or whether on YouTube. But it makes for such a rich discussion, especially for our two experts tonight, to know where you are joining us from. Look at this. From around the globe, we have Pillar. I'm not sure how to say that last name, but from Santiago, Chile. I don't want to mess it up too badly, but from Chile. Do either one of you know Sanjeev or Tamari? Give me a thumbs up if either one of you know Pilar. Maybe not, but it's so nice to have you with us tonight, all the way from Chile. Susan Ang joining us from Toronto tonight. I love it when I see people from around the globe joining in. Stas says tonight that thank you very much. He's looking forward to tonight's discussion. We are zeroing in tonight on collaboration. Collaboration is our big word tonight that we're going to talk about over and over again between dentists and doctors, and the importance of it, and ultimately how it can make a difference in so many lives. I was just telling our listening audience that if you are signing on or logging on, please go ahead and introduce yourself. And just as you are doing right now, throughout the discussion, your questions are welcomed. I appreciate them. I will work them into my interview with our experts tonight. So no need to be quiet and wait until the end of the interview. If questions come up as I am interviewing them and they are talking, I will work them into our discussion. Looking at time now, I want to be respectful of time. Continue to introduce yourself. I'll work your comments in. And I do want to get going because we do have a packed discussion tonight and lots of information to pass on to you tonight. Hello, Ron. Where are you joining us from tonight? We appreciate your time and you being with us as well. So, as I mentioned, tonight is going to be a very exciting discussion and an opportunity for all of you to learn why interprofessional collaboration between dentists and doctors is so important in the diagnosis and the treatment of sleep apnea. So, on that note, I want to begin and say hello, everybody, dentists, doctors, researchers, scientists, and friends joining us from around the globe. Welcome to our now fourth live broadcast in our ongoing series about the science of sleep apnea. Now, every few weeks, we welcome doctors from different disciplines who share their expertise in the diagnosis and the treatment of sleep apnea. So far in this series, we have interviewed a cardiologist, a neurologist, and a sleep specialist for both adults and pediatrics. And coming up, we are going to have on an endocrinologist, an anesthesiologist, an obstetrician, and even a pathologist, all talking about the prevalence of sleep apnea and the prevalence of it from their different disciplines. So tonight we are very excited to welcome our guests because tapping into this demographic is key to bridging a very important gap. We have a primary care provider joining us with extensive experience diagnosing and treating sleep apnea. And it is so important to talk to someone in this area because this is where the diagnosis starts. And in many cases, it's not happening. We will dig into that very issue and explore the why of that issue a little bit later. Also with us tonight, Dr. Tamara Height, who is the driving force behind these broadcasts and so determined and passionate about fostering more collaboration between doctors and dentists in diagnosing sleep apnea and ultimately in saving lives. Dr. Height will share some incredible research results that show she has successfully reversed sleep apnea in patients. I will let her talk about her research, how she's done it, and how AHIs can be cut in half. Dr. Height has spent the last 25 years working in general and craniofacial dentistry and lecturing worldwide to dentists, orthodontists, and medical doctors right around the globe. My name is Carrie Dahl. I was a long-time television medical reporter and 6 o'clock news anchor turned public speaking coach and podcast host. And I am so honored to serve as your host for tonight's virtual event. We appreciate the time all of you are taking out of your busy lives to listen and to participate in tonight's broadcast and learn more about the incredible work involved in diagnosing and reversing sleep apnea. As I mentioned a little bit earlier, and I want to stress this, we want this event to be as informative as possible and as interactive as possible. So please, I encourage you to join in on this conversation. I will read your questions and your comments as they come in. You do not need to wait until the end of the broadcast. So if there is something that you want to talk about, something you want to ask of either expert, just type your question in the comment spot. And as they come in, I will read them out. Just make sure that you grant StreamYard permission to use your name so I can see who actually is asking that question. We have more people joining us. Lawrence Kotlow once again with us. Or pardon me, Larry. It's Larry Kotlow, pediatric dentist in Albany, New York, and also Shilpa joining us from Pittsburgh, Pennsylvania. Thank you so much for introducing yourself. So the format, everybody, for the next 60 minutes is quite simple. I'll begin by interviewing family physician Dr. Sanjeev Jain, a consultant sleep disorders physicians at a number of labs in the GTA, the Greater Toronto Area. Dr. Jain has created a platform for interprofessional collaboration between dentistry and sleep medicine with a goal to optimize sleep care. Following that interview, I will then talk to Dr. Tamara Height, who is based out of Edmonton, Alberta, Canada. She will discuss her research, the novel approach she used, and then, of course, her results. Then we will bring back Dr. Jain for a joint discussion. There is a lot to cover tonight, and research work in this area is saving lives. You will hear more about that momentarily. We will aim to wrap up the evening and our discussion at 7 o'clock Mountain Standard Time. If you must leave early tonight, I encourage you to go ahead and watch the recorded version of this broadcast at the scienceofsleepapnea.com. Make sure that you check it out there, because all of our broadcasts are there. So go ahead, all 4 of them will be posted there, and take a look at them. And there's so much good information and so much great education. So the scienceofsleepapnea.com. So with that, let's dig in, shall we, by welcoming Dr. Sanjeev Jain, a family physician with a long-standing practice in Oshawa, Ontario. He has held various leadership positions at the Regional Hospital and the Ontario Medical Association. He returned to the University of Toronto to complete a fellowship in sleep disorders medicine. His contributions to the field of sleep medicine also include authoring a chapter in the Encyclopedia of Sleep Disorders Medicine, published through Stanford University, and peer-reviewing papers submitted for publication to the Journal of Psychosomatic Research. Dr. Jain works as a consultant sleep disorders physician at a number of labs, as I mentioned, in the Greater Toronto area. He treats the full spectrum of sleep disorders, including sleep-disordered breathing, parasomnias such as REM behavior disorder, hypersomnias, including narcolepsy and circadian disorders. He is open and supportive of evidence-based complementary and alternative medical treatments, and has a special interest in optimizing sleep and performance in elite amateur athletes. Dr. Jain is currently working full-time with a focused practice in sleep disorders medicine. He's particularly proud of his leadership in creating a platform for interprofessional collaboration. There's that magic word again tonight that we're going to keep talking about. Collaboration between dentistry and sleep medicine with a goal to optimize patient care. It is my pleasure to welcome the one and only Dr. Sanjeev Jain to our broadcast tonight. It is so nice to see you joining us from Toronto.
Thank you so much, Carrie. I've been referred to as the one and only, but usually not for good things.
Well, tonight you're the one and only.
It's an absolute pleasure to join you today and talk about interprofessional collaboration, and we'll talk about that a little later. But I'm absolutely thrilled to be invited. I have watched all 3 other seminars, and as you said, there was a lot of useful information. I asked a bunch of questions. I asked so many questions, they asked me to speak.
You were great for the discussion. And I have to begin here by just poking a little bit of fun, because I know all the other doctors will be able to relate to this. You said you had a horrible sleep last night. Tell us why.
So it's ironic. I mean, I work as a sleep disorders physician. I tell people they should be sleeping at night and be awake during the day.
Yes.
The sleep technologists stay up all night, and one of our patients couldn't sleep. So, and the technologist wasn't able to get him to sleep. So he phoned me, and I said, now there are 3 of us that can't sleep.
Oh, boy.
But anyway, it's all right. I can relate to what my patients experience when they've been sleep deprived. And it's not fun.
Right. No, not at all. And this is an issue and a condition you're so passionate about, especially about doctors and dentists working together in collaboration. Why is this so important to you?
You know, I was very fortunate. Very early in my sleep medicine part of my career, I began to work with dentists that were airway centric, that specialized in temporomandibular disorders. And they would send their patients to me because they had access to me as a primary care physician. I ended up learning a lot of oropharyngeal anatomy and the interplay between sleep disordered breathing, bruxism, temporomandibular disorder. So my colleagues would say to me, you know, I get to see older men that are heavy with a short, thick neck. How come you get these slim, tall women that come to you for sleep disorders? And these, I'm seeing more and more young women, young adults with temporomandibular disorder. And this is not the typical caricature of sleep apnea. And it's one of the first presentations. And well down the road, they will develop the serious medical consequences that untreated sleep apnea leads to. So dentists are seeing, before doctors are seeing the complications of underlying sleep apnea. Also, dentists are ideally positioned in healthcare. They see, almost everybody has a dentist. They see everybody when they're well. They can look at the oropharyngeal structure and really be aware of structural abnormalities that predispose someone to a compromised airway. So long before there's complications of sleep apnea, the dentist can identify those at risk and intervene early. I've always believed in prevention and health promotion, and that's why my collaboration with dentists has really made my career very rich.
So important. So let's dig in, Dr. Jane, and begin by talking about the prevalence of OSA and who in your practice is actually suffering from it.
So this is a slide that really shocks most people. Whenever I present it at any continuing education event, most people cannot believe that out of 100 people, let's say in the United States, out of 100 people, 4 to 5 have been diagnosed. Some of them are being treated if they've been offered treatment. 22 other people have sleep apnea and they are not aware of it. On the right side of the slide, you can see the serious consequences, both with respect to metabolic disease like diabetes, increased risk of stroke, atrial fibrillation, coronary artery disease. That happens years down the road when sleep apnea has been untreated for a long period of time.
Okay.
The prevalence alone of obstructive sleep apnea is probably around 20% in the 30 to 70-year age group, but 33% of adults between 50 and 70 suffer with moderate to severe sleep apnea. We're not talking about mild sleep apnea. We're talking about sleep apnea that has serious consequences. And women tend to get this as they go through menopause. So perimenopausal or postmenopausal women are at a very high risk for sleep apnea.
So is there anyone else? Who else is particularly at risk for, and should be screened for OSA?
I want to backtrack a little bit because I'm a family physician. And when I go to continuing education events, if I go to a talk on osteoporosis, it's like I can spend a half hour with my patient on osteoporosis. If I go to a diabetes talk, everything is about diabetes. And a family physician has very limited time, but there are patients in our practice that are at very high risk for sleep apnea, and I've listed them here. Individuals with type 2 diabetes have 60 to 70% chance of having sleep apnea, atrial fibrillation, coronary artery disease, and stroke. What frustrates me at times is an individual will get referred by their dentist because they had a fractured tooth. And the dentist caught on to the fact that maybe there's underlying sleep apnea. And when I take a medical history, 10 years ago, they had a TIA or they were diagnosed with atrial fibrillation. Not only the family doctor did not clue in, but the cardiologist, the endocrinologist, the awareness about sleep disordered breathing and sleep in general is gradually increasing. And I think we're at that point now where there's a Netflix documentary about why we sleep. We hear more and more about sleep apnea as the baby boomers are aging and want to keep their health, and they realize that prevention is the way to go, and treating sleep apnea. Sleep quality is deprived when you have sleep apnea or other sleep disorders. So everybody understands that you need more than 4 hours of sleep per night. But if you're getting 8 hours of sleep, but it's interrupted because you're not breathing well, effectively, you're only getting 3 to 4 hours of sleep and you're not functioning at your optimum.
That's right. Something that you're seeing great success in is the use of telemedicine for easier access and assessment. And this is something that's really important to you. So tell us more how you're using it.
So, COVID has hit the world very hard. In every dark cloud, there's always a silver lining. And one thing that COVID has done is accelerated the adoption and acceptance, both by patients and by physicians, of telemedicine out of necessity. Before, we had to have forms in our office that we filled out. Now they're all available online. Geographic considerations in seeing specialists, you know, that were only located in, let's say, in the major urban centers. Now the rural population has access to those specialists. We've created a platform for interprofessional collaboration called Sleep Care Hub, but there are other platforms where specialists and family doctors all coalesce on one site and share one EMR to effect optimal care. Since I entered medical school, dentistry and medicine have practiced in their own silos. We've never exchanged records. You go to your dentist, I don't know what happens as a family physician to a patient who goes to the dentist, and vice versa. We've created a platform where we share information between dentists and doctors, and this ultimately, we believe, will lead to optimal patient care.
Wow, that is such a step in the right direction to increasing collaboration in the world that we live in. So you mentioned, Dr. Jane, a little bit earlier, as a family physician, you just don't have a lot of time. And that's a reality for every family physician, to be able to diagnose and treat. So is there an easy to use screening tool to help identify those at risk?
There is an easy to use tool that you can leave in your waiting room while the patient is waiting for you. And they can answer these questions, and it's easy to remember. It's called Stop Bang. So S stands for snoring, T for being tired during the day, excessively so, O for observe breathing pauses, and so on. If someone is overweight, is over 50, the neck size is enlarged, and they happen to be male, these are all increased risk factors for sleep apnea. So if on this set of 8 questions, if you score 4 or more, you're at a high risk for sleep apnea. So being a man and being over 50, you're already halfway there. If you score 3 out of 8, the risk is intermediate. It is, you know, gender, like it's biased towards the male gender because of the male gender being part of the Stop Bang questionnaire, but it's still a very useful questionnaire in the primary care office.
Such a great tool that saves so much time by the time they walk through the door, and you can start treating them based on those results, right?
Right.
Okay, so the next question I'm curious about, does there have to be a complete cessation of breathing in sleep apnea?
I get this question from patients, from physicians all the time. And, you know, people tell me, I don't stop breathing. My wife would tell me if I stop breathing. The fact is that if the airway is partially compromised, as it is in the second image from the left, the amount of oxygen that you can take in from the air is less. The oxygen saturation level drops in the bloodstream, and the brain senses that drop of 3 or 4% and it mounts a stress response. It doesn't care if the oxygen drops 10%, 20%, or only 3 or 4%. It's going to mount that stress response. We call that intermittent hypoxia. So it's not the degree of oxygen desaturation, but the number of times it happens through the night. When this happens, that you either stop breathing for at least 10 seconds, or you have shallow breathing that often lasts a lot longer, and you mount that stress response more than 30 times per hour. That's considered severe sleep apnea. And if it's more than 15, it's moderate. Most studies show that if you have moderate to severe sleep apnea, you're at a significantly higher risk for heart disease, stroke, and diabetes. So it is significant. Whether you stop breathing or you have shallow breathing, that's why we call it the apnea-hypopnea index. The 2 events are still considered equally deleterious to your health.
You mentioned diabetes, Dr. Janes. So are people with diabetes more likely to suffer from OSA?
The prevalence of sleep apnea in diabetic patients is 66 to 70%. Further, if you treat the sleep apnea, you actually improve glycemic control. Every time I see a patient and they say, well, how can this be possibly related? What happens when you have interrupted sleep and you have sleep apnea is that it upsets the normal balance between the hunger and satiety hormones called leptin and ghrelin. And you are actually starving and hungry for starchy, high-calorie foods. So I saw a patient yesterday who asked me, he said, you know, ever since you started me on CPAP, I've actually lost some weight. Is that possible, or am I imagining things? And I talked to him about this leptin, ghrelin thing and not being hungry for starchy, high-calorie foods. And he said, how did you know that? How did you know I don't have those cravings anymore? That's how it impacts other metabolic conditions as well, but specifically diabetes. And it's rewarding when I treat patients with sleep apnea, with CPAP or other treatments, when their glycemic control improves and their need for insulin decreases. One more thing. So sleep apnea creates a pro-inflammatory, pro-coagulation state, and it leads to insulin resistance, which is a precursor of diabetes. If that goes on for long enough, the pancreas burns out, and that's how you develop diabetes.
You were talking about the use of telehealth and then the form that patients can fill out prior to coming through the door to see you. But just talk about what kind of impact could be seen if there was a true collaboration between family physicians and dentists.
You know, we're very fortunate in Ontario, in the area where I work. I have excellent colleagues that I work with that are dentists, that are airway centric, and we have team meetings. We will discuss patients. It bothers me sometimes because we have such a personal relationship. They'll phone me on a Saturday, but I don't really mind. And we'll discuss certain cases, and it's fascinating what I learned from them and what they learn from me. So it's a two-way exchange.
I know that Dr. Height is going to be talking about the dental device from Vivos that she uses. Have you seen any patients treated with that device, and what kind of results did you see?
So we have, in Ontario, we're a little bit further behind than Alberta. There's only 2 or 3 offices that are offering Vivos. And I've already seen a couple of patients, only a couple, but they've had dramatic improvements in their sleep apnea. When this patient was diagnosed with severe sleep apnea, had an AHI of 63, started on CPAP, started with Vivos, and now the AHI is down to 6.3. So very soon, we will be able to get this person off of CPAP. Believe me, this is news to me. It is news to most of my colleagues. I've been reading about it, and now I'm seeing it firsthand with patients. It's truly exciting. There is a dental treatment for a serious medical disorder. It's unbelievable.
It really is. Dr. Jane, I appreciate, and I know everybody listening appreciates your advice and your perspective. Our audience has been particularly quiet, I think, because they're hanging on your every word, but I know questions will come. So that's a reminder for those of you watching and listening. Don't be afraid to ask your questions. But right now, I'm going to give you a bit of a break and let you go into the virtual green room and relax for a few minutes. And on that note, it's now my pleasure to introduce Dr. Tamari Height, who has spent the last 25 years working in general and craniofacial dentistry and lecturing worldwide. For 10 years, as I mentioned, to dentists, to orthodontists, and medical doctors on her published research and findings. And as I mentioned at the beginning of her broadcast, Dr. Height has successfully reversed sleep apnea, which she will talk about. She is on a relentless mission to get dentists and doctors to work together on the diagnosis and the treatment of sleep apnea. So here we go. Dr. Height, what a pleasure it is to chat with you again this evening.
Oh, thank you so much. And Sanjeev, Jane, you make me cry and wreck my makeup. That was a beautiful presentation. Thank you for saying that. I loved it.
And Lawrence Cotlow asked a great question, and Dr. Jane, I'm going to circle back to you later, so I'm planting a seed. He said, do you think that juvenile diabetes can be caused by OSA? I want you to think about that, and I want you to think about your answer when I bring you back. But first, Dr. Hite, I want to start here. You had a really interesting week, and I want you to talk about it because this is unusual for you. You had 2 clients come to you this week from a specialist office looking for a second opinion from you. So that seems a little bit odd to me, but just tell us what happened here.
Well, it's, yeah, it is odd. Like, I do get referrals from the specialists themselves, but these ones actually came from the patients who were in the specialist office. So that's what's unusual about that. But, you know, I just did my usual thing, the history, the exam. And at the end, you know, when I came to the diagnostic statements, which I give to them in a letter, both of these kids, the parents brought their kids in. I thought both of these kids would have sleep apnea. So we arranged for a sleep study. And it turned out that the sleep study was positive. And naturally, you know, as a dentist, I don't diagnose sleep apnea, but I am allowed to get a sleep study and have it read by a board certified sleep specialist. So then I gave the results to the parents, and I asked them to go back to their primary care providers and just, you know, get a diagnosis and ask their professional opinion. And both the medical doctors said they didn't believe in it. And, you know, these kids had all the signs and symptoms of sleep apnea. And, but I want to be clear, Carrie, this is no disrespect to my kind doctor colleagues or any of the work that they do. But we've got to stop shying away from this deadly condition. It needs to be talked about. And there's this big white elephant in the room. That's why we're here today. You know, doctors and dentists are free to diagnose how they say, how, you know, what they can diagnose how they see fit. And I feel really bad for the primary care providers because they need to know so much about every body system, about all the diseases. They're run off their feet. You're getting pay cuts. You know, they're in the middle of a pandemic. They're worried about their own health and the health of their family. And you know what? I want to help, and dentists want to help. And the time is now. And I really feel like this is the secret epidemic of obstructive sleep apnea.
That's a big term. Secret epidemic. What do you mean by that? That's huge.
Well, yeah, it's all around us. It's if you know, I'm going to show you when I get to my slides, the way I see the world now, because it's almost like once you know the signs and symptoms of sleep apnea, and even what Dr. Jane said, you know, helping the medical doctors screen for it, you start to see it when you leave the office and in the papers every day, and you see it. It's all around us. I was a nurse for 10 years and a dentist for 25 years. I've been seeing it all over the place.
Lisa Babiup is agreeing with you, saying, well said, Dr. Hite. So you're not alone in feeling this way. And, you know, what touched me too is when you came on after Dr. Jane finished talking, you said you were crying. That's real, because you are so passionate about your work and passionate about building that bridge of collaboration between dentists and doctors in order to ultimately save lives. And on that note too, you're writing a book about this. Tell us about it.
Oh yeah. Well, I think, you know, I'm in the middle of working. I'm successfully reversing sleep apnea. I'm running clinical trials. I'm trying to figure out, you know, how this dental treatment works the most efficiently and what kinds of patients, you know, and I'm collaborating very closely with some very special medical doctors and researchers. And, you know, these are the people that understand the impact that dentists are having on the anatomy and physiology of the patients, which is what I want to show everybody. And this is a really exciting time to be a dentist. And but I'm standing on the shoulders of giants as I write this book. And so this book is about reversing sleep apnea. It's got the recipe for it in there, you know, but it's also about collaborating with the scientists in all areas of medicine, and not just the clinical providers. They're so busy. There's like this spectrum of, you know, there's the clinical providers, the dentists and medical doctors working in the trenches. And then on the other end, there's the scientists and the university professors and the people doing the research and things like this. And this is where this is going to come together, because, you know, Dr. Jane is talking about the science and, you know, how diabetes is affected by sleep apnea. And that comes from the universities and from you know, research trials and things like that. So that's the area of interest that I have. It's collaborating with these scientists in all areas of medicine, because it affects, sleep apnea affects every single specialty in medicine. And in the future, it's about prevention in children, and that's going to happen with the primary care physician and dentist. So this book will be chock full of opportunities for theses and research and topics in universities. And, you know, as I write this book, I'm discovering the book is writing me.
That is so powerful, because that speaks to your work in this area. I want to bring in a couple of comments on that from Solveig. I hope I've said your name correctly. The elephant in the room is well documented. Primary care physicians have on average 4 hours of sleep training. Thank you for stepping up, dental community, and addressing this severe issue, sleep disorders, and helping us help patients. That's got to make you happy to hear that comment, Dr. Haidt.
Well, I know Solveig, and she also is an ambassador in this. There's a company called Sleep Image, and if you go to sleepimage.com, you're going to see some fantastic research. And this is cutting edge technology that wet-fingered people in the field need. These sleep devices they're making that are inexpensive, they're easy to read. You know, you get your results the next day. It's easy for the board certified sleep specialist to interpret the data, and then for the physician or the dentist to use that to help speed the diagnosis, and for dentists to actually check their work. So they have some incredible technology. And you can also see that at vivoslife.com. It's called the Vivo Score. And the technology is really going to help us and make it a lot easier. So she's really something, and contributing to this whole thing. So,
okay, Dr. Haidt, you mentioned that keyword again, collaboration between dentists and doctors. Is it happening enough?
Well, it's starting to unfold kind of organically. It's happening more and more, and you know, I'm hoping these webinars help, and we're reaching out. You know, what I would love to see is the Academy of Sleep Medicine join with the Academy of Dental Sleep Medicine. It should be one conference, and we need to come together, because we can do all this research together and really have a better impact on our patients.
And that is the key, right? To be inclusive of all areas of medicine, so no one feels left out.
Yes. Yeah.
Okay. Let's dig in even further and talk about what was the term? Secret epidemic. Let's go there. What you mean by that? You said you have a slide that you want to talk about that demonstrates this perfectly.
So I feel like sleep apnea is epidemic, and I think it's a secret epidemic, and we have to let that secret out. And, you know, this was on the front page of the Edmonton Journal just on April 15th. And what you see here is an SUV on top of a dental chair. and it's kind of like the first thing that crosses my mind. And of course, I don't know anything about this accident, and I could be completely wrong. But the first thing in my mind is this person might have had sleep apnea or had one of these episodes that people fall asleep at the wheel. And, you know, same with someone like Tiger Woods. Like, I love sports and athletes like crazy. And I love Tiger Woods. And when I saw the accident he had, I was just devastated. And so I read back on it and followed it. And I just feel like, you know what, he's got the best doctors in the world. I wonder if he has sleep apnea. And if you dig into his story further, you'll see that this isn't the first time he's had a car accident and things like that. So I don't know, again, what the specifics are, if that's, you know, if I'm way off base, but, you know, get tested for sleep apnea. And guess what? Find out that it can be reversed, because even your medical doctors might not know about that. So I want to show you what I did in my clinic 7 years ago. I screened this patient that was sent to me by another dentist with a chief complaint of find out what's wrong with me. Like, talk about a broad chief complaint. But I screened her, I did a sleep study, and her apnea-hypopnea index was 118. And to make a long story short, this is written in a medical journal. This is published in a medical journal that her sleep apnea was completely reversed to 1. And yeah, I worked collaboratively with medicine, and they took her tonsils out and we got it down to 70. But after that, that's where she stayed. And then until we stepped in dentistry, and we completely reversed her sleep apnea down to 1. And this sleep study was done with no appliance in the mouth and with no CPAP on her face. And I looked to my medical colleagues to give me the initial diagnosis, and then again, the follow-up diagnosis. So this patient would go back to the medical doctor with this, essentially be undiagnosed, and then they could, you know, treat the rest of her conditions that resulted from, you know, probably long-term sleep apnea, and really help her out. So that's something you guys can look up and read in a medical journal. So
how did you do all that?
Well, it turns out that, you know, sleep apnea is a disease of craniofacial anatomy. So when I presented this at the Academy of Sleep Medicine, the medical doctors there, they asked me, almost every single one, you know, did she lose weight? And she didn't lose weight. In fact, I didn't know, because I don't weigh my patients in the dental office, or I didn't at that time. I do now, but I just phoned her up and asked her. She did not lose weight, but this is what happened to her craniofacial anatomy. If you think of her teeth and jaws like a garage, and the tongue is like her car, if she has a small garage, the tongue is crammed back into her airway. So before treatment, you can see the top photos. She has a garage for a smart car because her bottom jaw is too far back, and her bite is deep. So that means her top teeth, you know, overlap her bottom teeth. It looks like about 50–60% there. And, you know, after treatment, that's where her bite was, and that's where she functioned and chewed. And, you know, it's very easy for the orthodontist to line the teeth up so the cusps and fossas interdigitate in phase 2. But phase 1 is orthopedics and pneumopedics. Pneumopedics is development of the airway. So there she has a garage with a 10-foot ceiling. And when you look at her from the front, you know, on the left, she has a 1-car garage, and on the right, she has a 2-car garage. So this is what dentistry can do. We did this in 9 months with this girl, and she wore CPAP the whole time. I think it works better with CPAP because it grows the bone with kind of like distraction osteogenesis 3D. And everybody knows to grow cells, you need oxygen. So this treatment, you know, can be done in conjunction with CPAP. But we all know that many people can't wear CPAP. However, when faced with an opportunity to potentially reverse their sleep apnea, I actually have a lot of patients compliant with CPAP, knowing that it might be just temporary. So that's how I did it.
I mean, the change in her face alone is stunning. It's a huge difference.
Well, she's got a smile on her face, but I'll tell you, you know, I'm not sure if the next slide I show, like there's people, yeah, like this girl has a big change in her face. Yeah. And I didn't do a sleep study on her. I don't even know how many people I've reversed, but she just came to me.
How many have you reversed sleep apnea in?
Oh man, I don't even know, probably a couple hundred. But you know, in the beginning, like this person here, she came to me with headaches, and everybody knows that, you know, if the brain doesn't get oxygen, it hurts. It gives them a headache. But headaches and sleep apnea are very, very closely related. And she came to me with headaches. And at this point, this is one of my first patients. You know, she knew that I had a dental device to help get rid of headaches. And she didn't want to take drugs or do surgery or anything like that. So I said to her, I wasn't sure if this was this new device that I was trying at the time, the DNA device or the Vivos device. I wasn't sure if it is going to work, but we could try it. And I wanted her to stay in treatment for 18 months because I wanted to see how it worked. So she did. And that was how much her face changed. Now, her headaches went away within 3 months. And that kind soul stayed with me 18 months. And look at the difference in her face. Like on the left, you know, you can see she has a double chin. You know, you can see her teeth are crooked. And that's because her upper jaw is too small. And on the right, after 18 months, her upper jaw grew so big that we're now able to line her teeth up and there'd be room for the teeth. So you got to know that dentists are taught that you can't grow the upper jaw in adults. And that was a null hypothesis that since has been disproved because of this patient and 12 others in my clinic who we actually measured the bone volume of the maxilla. And we grew the maxilla, the upper jaw, by 1.8 cubic centimeters of bone volume, and it grew 3D. Now, dentists has been doing this for a long time with other techniques, but this one technique, it's less about the device and more about the technique, actually grows the jaw 3D and the nasal airway grows 3D, and that allows her bottom jaw to come forward and open up the airway in her neck. So pneumopedics is development of the airway. We changed the anatomy of her, both in the nasal airway and in the airway in the neck. And I didn't do a sleep study before and after treatment, but I believe she probably had it because I've treated so many patients after, and we are doing sleep studies on those patients now.
Okay. And let me get this straight though. Like you reversed sleep apnea in her without even knowing it.
Well, I'm just saying that would be my hypothesis. I have no way to prove it because I didn't do a before and after sleep study on her like the other patient you saw prior to her. But these things are published. So, you know, the medical doctors and the dentists can learn about these things from various areas, which is what we want to do today. We want people to learn what research is out there. I want to learn what research there is in medicine. I want to know what's going on in the university in some of these areas. Specifically, I'm very, very interested in endocrinology and the impact of sleep apnea on diabetes. And Dr. Jane talked a little bit about that. I want to get experts that can tell me about the science of it, you know, because what's happening in the clinic is a little bit different, I think, than the science of it. And so the science is coming so we can see the impact of this action that we're taking in the clinic. And patients are choosing this treatment. You know, some patients don't want to take medications. They choose this device.
And Dr. Height, it all comes back to everything you're talking about comes back to collaboration between dentists and doctors. And you're a massive advocate for this because. Well,
you know, I believe that medical doctors and dentists, they just want to help their patients. And, you know, it turns out that a lot of people have sleep apnea that don't look like they have sleep apnea. So we need to get together and learn what each other knows. And, you know, we want to, we've got to work together, and whatever it is that's stopping medical doctors and dentists come together, you know, we're the same. We both want to help our patients. Dentists might like doing things with their hands more, but you know, my very favorite athlete is Jackie Robinson, and I put a slide of him in there I saw, and he says, you know, a life is not important except in the impact it has on other lives. And I feel like dentists and medical doctors are like that. That's our purpose in life. And what we need to do is do what Jackie, look at the impact he's had on lives and the world, this Jackie Robinson, and how everybody celebrates him. I'm learning from him. He's my mentor, and I want to, you know, help get medical doctors and dentists together because it needs to be done. We need to get rid of this white elephant in the room and treat our patients together.
I have a couple of great comments coming in, but I'm going to wait until Dr. Jane joins us. But I want to ask you, Dr. Height, what are your actual results so far? Share them with us.
Well, I've been measuring headaches for a long time. These are results from a couple of years ago. I use HIT scores, so the headache impact test. And what you can see in this slide is, you know, these patients, their headache impact tests are all coming down. So this data needs to be, you know, gathered and analyzed and everything like this. And, you know, a bunch of this data is going into, you know, the FDA and stuff like that. They're looking at that, and that's important. And I'm learning about how important the role is of our governing bodies and our different sort of formal places where we can get this. And, you know, we don't want to publish this so that they can use this data. And also, you know, in sleep apnea, you know, these are some of the results I've had where just in a snapshot of time, and again, this is informal and this slide looks funny, but the dark blue pre-treatment are the people who had severe sleep apnea. And you can see it's a group of patients that all had sleep apnea. You know, there's severe, the medium blue is moderate, the light blue is mild. And then post-treatment, the very, very light blue is people that whose sleep apnea result is below 5. So you can see the severe has poured into the moderate, has poured into the mild, and many of these patients are completely reversed. And, you know, the evidence is in the clinics of the dentists, because now, you know, Vivos Therapeutics has an airway intelligence service. There's 11 or 12,000 patients in treatment, and these doctors are taught to take sleep studies before and after treatment. So, you know, having an AHI before and after treatment is very, very important. And the next step is going to be to sort of gather that data and see what the results are, remembering that they're all learning how to do this procedure. And it's you know, fun for the dentists, but everybody kind of puts their own little spin on it. But there's some basic things they need to do and recognize the difference between this and other procedures we've done in dentistry. And, you know, measure the sleep results and then gather that data. And we have to do it in a scientific way. And we have to, you know, consult these boards and these governments, because, you know, the job of the government is to, you know, provide treatment and keep the patients safe and things like that. So they need to be scrutinized by these people in the universities, and that makes sense with their research. So the stuff I'm learning from the scientists helps me in the clinic make decisions and observe things in patients that I otherwise wouldn't.
Before we bring Dr. Jane back in, quickly, I want to know, in the interim, as you're making these steps forward, how is medicine handling these patients?
Well, this is a paper I got from Yuri Kolemsky that shows the top 10 drugs that are used to help patients with craniofacial pain. And the people you see in red are the people these drugs don't help, and the people in blue are the people they do help. So the best in medicine can do is 25%. And at the snapshot of time I just showed you there, 80% of the patients are improving by 50%, you know, in my hands. And I'm one of the teachers. We're setting protocols, working with universities and things like that, and helping to teach doctors. And as the dentists are learning, they're teaching and learning at the same time, because we're using devices that are already in use, and we're just observing these medical issues.
So on that note, then, as we wrap up, let's bring Dr. Jane back into this discussion as we talk further about collaboration between dentists and doctors. And I want to acknowledge a few of the questions that have come in. Lawrence Kotlow says this: I can see as many as 6 to 10 infants and children a day with obvious symptoms of airway blockage due to severe, correct me if I'm wrong, is this ankyloglossia? Am I saying that right?
Yeah.
Is that correct? Which is ignored by PCP. How do you collaborate when the PCP ignores? Dr. Jane, or who wants to tackle this?
Yeah, this is a very tough thing to tackle, because not only do we work in our silos and we don't communicate, there's no forum in which we regularly meet to discuss this kind of thing. First, you know, we can say education, 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 but there isn't even the awareness that a dentist may be able to help in this area. So I used to get referrals from my dentist friends, and they would say, this patient has a tongue tie, and that was all that was written on the referral. And I said, well, why are you sending them to me? And I had to learn why the tongue tie was so important. It's important to Dr. Haidt. It wasn't to me until I went to the trouble of learning about it. And I ended up immersing myself so much into learning this part of the anatomy that I'm now an instructor at the Faculty of Dentistry at U of T. So we need to start communicating with each other. We speak different languages. You think lawyers and doctors speak different languages? So do dentists and doctors. And we really don't talk to each other. We have common patients, and they would be better served if we did start to communicate with one another. And
I have a perspective on that as well, because I've been in the same shoes as Dr. Kotlow and feeling the same frustration. But I always turn to my medical colleagues and I pose the same question. And of course, I said that to one of my favorite ones. I said, what do I do? Or what I just told her the story I told you guys. And she goes, well, the patient just goes to another doctor then. And so that's where it comes into, you know, the governing bodies and what's required about, you know, for medical doctors and for dentists, what's required. And I know in Alberta, we've made some headway. Part of our licensure is we have to disclose whether we treat sleep apnea or not, and whether we've had training as a first step. And then the next step might be like, what training have you had? And then the governing body has to figure out, like, oh my God, who do we approve training for? Like, what kind of training? But dentists, there's many, many dentists learning about sleep apnea. And now it's time to really get the medical doctors on board. And the best way to do that is help find the medical doctors' sleep apnea, because there's a lot of medical doctors that pass away from sleep apnea.
Yeah. And look at this, Dr. Haidt and Dr. Jane. Ron Dwyer says dentists need to be allowed to diagnose. That would be so much easier and help so many people. Thoughts?
I feel like dentists aren't qualified to diagnose systemic disease. And I feel like the governing bodies are correct in saying that this is not something that a dentist should diagnose, because we don't know as much about, we're not trained the way medical doctors are. This is something we need to collaborate with the medical doctors. So I agree with our governing bodies that dentists should not diagnose sleep apnea, but we could be like, be the pharmacist. When a medical doctor writes a prescription, the pharmacist can fill it and advise the patient. And that's, I think, the role for the dentists. But the medical doctors need to diagnose sleep apnea, because it's way more complex than we even know. And we don't know what we don't know. And I'm interested to hear what Dr. Jane has to say.
I think that patients will drive this movement forward. As patients learn about a treatment that reverses sleep apnea, or it's an alternative, and they can wear their mask for some period of time while they're getting this treatment, patients will force their doctors to learn about a dental treatment for a medical condition. There's absolutely no question. I agree that a medical physician should diagnose sleep apnea, much the same as I've learned considerable amount about the oral pharyngeal anatomy, but I don't pretend to be a dentist. The other day when one of my dentists colleagues and I were talking, and although I've always screened for pronathia as a risk factor for sleep apnea, I didn't understand that the reason that the chin being protruded forward is a risk for the airway is that the maxilla is not developed. It's not that the chin is too big, the maxilla is too small. I hadn't thought about it that way. So no matter how much we learn, the specialist in that field always, the master makes everything simple. And the dentists are masters in this part of the anatomy, and the physicians manage systemic disease.
Thank you for saying that.
That's powerful. And Solveig weighs in and says, not only does this approach that dentists are taking the initiative to screen for sleep apnea, improve patients' future health and quality of life, this also decreases healthcare costs in the future. Great work, Dr. Haidt and colleagues, and your comments about starting in children is spot on. I mean, right?
I wanted to answer the other question that you had about juvenile.
I was going to go back to that from Lawrence Kotlow about thinking whether or not juvenile diabetes can be caused by OSA.
So type 1 and type 2 diabetes are almost two totally different diseases. My comments were about type 2 diabetes and insulin resistance and related to obesity. Type 1 diabetes, we don't really know the cause, but the best hypothesis is that it's an autoimmune disease. So it's a totally different mechanism. That's the current thinking. No one ever knows enough, and science proves us wrong down the road. But at this time, it's not thought to be related to underlying sleep apnea.
Couple more comments here before we wrap up. Jacqueline B says, excellent presentation, and I agree with dentists and medical doctors collaborating. Jacqueline from the Sleep Institute.
Nice. And
a few people, Harmony, saying thank you, Dr. Sanjeev. Also, Ron Dwyer, I don't know if it's Sonia speaking on that account, saying, I agree, Dr. Kotlow, as a hygienist myself, going through DNA myself, dealt with sleep apnea for 12 years. I'm referring probably every third pediatric patient for early intervention.
Wow.
Good for you. Good job. You're saving lives. Mm-hmm. And essentially, that's what's going to happen. It'll be patient driven. And if you collaborate with your medical doctors, Dr. Kashida taught me, you know, just ask them, you know, do a lunch and learn or something. Just ask them, if they, just ask them to help. Mm-hmm. Just make the first move.
Solveig says, thank you, Dr. Sanjeev. You need to expand your teaching into the medical community as a primary care physician turning to sleep medicine or field wants to learn more and have colleagues that can help us. That's what we're getting at tonight, right?
Yeah. So one of the things everybody can do, the medical doctors and the dentists, is they can learn from the summit, the Airway Summit. And I know you made a banner, Carrie, that
sure did.
If they go to airwaysummit.com, there's, I think, 7 hours of training that you can get. And you don't have to pay any money if you use the code Sanjeev. So airwaysummit.com, use the code Sanjeev. And also I would say, like dentists, go to the Academy of Sleep Medicine, AASM.org. I don't know that they'll actually be teaching what we're doing, but you know where you can learn that. And if you go there, you can collaborate with some of your medical doctors, and maybe you're going to meet some of your medical doctors in your area. So when I go there and I see someone from Edmonton, I introduce myself as a dentist and have a drink together and listen to what they say and what's out there for people. Dr. Sanjeev, do you think if we're able to reverse sleep apnea with this dental procedure, this dental therapy, that it might replace CPAP as the gold standard for treating sleep apnea in the future?
I don't like to use the word replace. I think it'll be one of the alternatives. This treatment probably isn't for everyone. Let's say, you know, someone doesn't have any teeth left or they have dentures. You're obviously not going to be able to stimulate bone growth. But patients having options is really important. And some people are quite happy with CPAP and they live with it well. And there are some couples where both husband and wife wear CPAP and they think it's kind of cool. So leave those people alone. You don't need to fix them. They're happy. As long as the condition is being treated, I'm happy that they've reduced their risk for heart disease, stroke, and diabetes. And
I agree. I think I advise all my patients to use CPAP at the same time as I'm developing their jaws. And then, you know, every 3 months during treatment, we'll do a 2-night sleep study, both nights with no CPAP, 1 night with the device and 1 night without the device, because we just want to see what level their sleep apnea is without the device and without CPAP. Because if it's below 5, then we could say, wow, maybe you don't need it. But many times when we work with medicine, they can turn the pressures down in the CPAP. But I fully believe that the CPAP provides the oxygen for the stem cells to grow that maxilla.
So I find that using CPAP in the auto settings is what works best as Vivos is working, because as their pressure needs change, they don't need to come to me to get that pressure adjusted. The machine automatically adjusts.
Oh, nice. There you go. Collaboration.
And there, on that word, we wrap up. To everybody watching, I know we went a little long tonight, but I think you would agree that the information and the discussion is so rich, so many takeaways, and so much empowerment to work together, and the reasons why ultimately for saving lives. Dr. Height, Dr. Jane, what a pleasure to be able to facilitate this important conversation with both of you. Thank you both so much for joining us and for the education you provided tonight.
Thank you.
Thank you, Carrie. Thanks for hosting. You're amazing.
Well, the pleasure and the gift is mine. I say my producer and I are fast clicking tonight to make sure. I want to just recap a couple of things before you say goodnight. Dr. Height threw out a few different pieces of information. The airwaysummit.com is where you can go and get that more information. If you use the code Sanjeev, you can get the course for free. As Dr. Height was mentioning, that is 7 hours of instruction. Airwaysummit.com. Use the code word Sanjeev. That will help you along. I'm going to throw this up for you. There you go. There's also a lot of information at vivoslife.com if you're interested. And as I mentioned, this is our 4th live broadcast. So if you've missed any of them, or you want to share this or encourage someone to watch it, all you have to go to the website, thescienceofsleepapnea.com. That's where you can find all of them, and you can watch them there or share them with your colleagues and your friends. One final note tonight, as I mentioned, this is the 4th installment. There's going to be further ones coming along. So if you're interested in following along, save the date of May the 20th, 6 o'clock Mountain Standard Time. Our next guest is going to be an endocrinologist. So mark your calendars. A lot of people saying thank you for the great information as well. Stas says, thank you for the great presentation and discussion. I thank all of you for sharing your precious time with us this evening. And of course, heartfelt gratitude to both Dr. Height and Dr. Jane for sharing their expertise with us tonight. Thank you all so much for joining. Spread the word. Talk to your colleagues. Talk about collaboration. Send them to the Science of Sleep Apnea and get them to watch these videos and these discussions, because when we work together, we can ultimately save lives. To all of you who joined us, thanks so much. Have a great evening.